And I think this is the attitude we should take away from here on out. I think we should all have the confidence that our vaccines, therapies, protections, and stuff like that are actually really good. I think sometimes either social media or the media or people who are misinformed might spread fear that makes you second guess certain things and then start panicking and then you start stressing out about certain things about
Back
COVID
on.
and stuff.
Just want to say good evening, everyone. Welcome to our COVID conversations with Dr. Freddie Ray Ray. My name is Kevin Sunga. I'm the team director for the Equity for COVID and Health Outcomes, or ECHO team here at Little Manila Rising. Our goal as the ECHO team is to increase vaccine testing access in South Stockton for our marginalized communities and communities of color, and provide platforms where communities can collaborate and learn about COVID, how COVID is impacting their community. It's really great that you can join us this evening for updates on what we're seeing with COVID, getting a reminder of best practices to stay protected, and what's projected for the future. So this session is meant to be engaging. So if you have any questions at any point on what's discussed, please drop your questions in the chat. Most of today's live is a question and answer Q&A session. So please stick around if you have any questions. I have two team members, Koji Lewis and Giancarlo Shabauer, monitoring the chat and supporting too. So thank you guys for joining in. But yeah, without further ado, I'm really excited to introduce our special guest, Dr. Freddie Ray Ray, a local critical care pharmacist here in Stockton that has extensive experience working with COVID patients and analyzing what's going on with COVID. So hey, Freddie, what's going on? Really glad you can join us again and now in sort of this virtual space. And I'll hand it off to you. Like, do you mind introducing yourself and kicking us off, man?
Okay, yeah, so hello everyone. First of all, apologize for the lag. I don't know why it's happening. We did this practice yesterday, it was fine, but for those that don't know me, I am a critical care pharmacist. My specialty is in neurocritical care, trauma, COVID, and medical surgical ICU. So I see a wide variety of patients. And today I'm going to talk a little bit about COVID-19, some of the updates since the last time we had a meeting back in January. So to kind of start off, as you guys hear in the news, so cases are on the rise, which is something that maybe most people didn't really expect after the Omicron surge. And what I want to tell you guys is that although it might seem a little bit scary that cases are on the rise, there's a lot of different ways to protect ourselves. And the first thing that we all should kind of think about is, number one, getting vaccinated if you aren't already vaccinated. In the Stockton area and the San Joaquin area, most counties are actually 75% or higher fully vaccinated. So that's good. I would encourage your friends and family that if they haven't gotten their vaccines are now available for people ages 5 and up. And actually, this morning, the FDA and CDC approved vaccine boosters for pediatric patients, kiddos aged 5 through 11. So that's something to also think about. I know that boosters might not be for every child. I would encourage you to talk to your pediatrician to see what they say. And if you do have a kiddo who might have like a chronic disease such as cystic fibrosis or a high risk sort of situation, maybe the booster will be beneficial. For everyone else, there's a lot of good data out there, so I encourage you to get your first and second dose at minimum, and then try to get your booster, your third dose, and if you're a super high risk individual, such as someone age 50 or over with a disease, to try and get your fourth booster, at least before the summer. Because I'm pretty sure that we might see a little uptick in cases just because people are gathering and school's out and stuff like that. Couple other things, make sure that if you are going to mask, make sure that you do surgical masks are better. So KN95s and 95s, particularly when you're in crowds where you don't know everyone's vaccination status. And yeah, when you're in a situation where maybe you're feeling a little sick and you don't know if you have COVID or not, or if you're around a high-risk individual, you don't want to get someone unknowingly sick. So that's something to think about. And then lastly, there's tests you can do. So for testing, obviously, you can get your free test through covid.gov. And then as far as testing goes, again, just a quick reminder, day 0 should be your first day of exposure or first day of symptoms, or the first day you test positive. So that kind of starts the countdown. So again, 5 days after you test positive or have symptoms for COVID, you should be in quarantine. And then after that, the next 5 days, you kind of want to monitor your symptoms. If you're getting better, you can, be as safe as possible and run the emergency errand you need to run in those next 5 days. Otherwise, I would recommend that you follow CDC guidelines and just quarantine until you get better for a total of 10 days. And then antigen tests are great for making sure, like, if you are positive and contagious, that will confirm that. PCR tests help with detecting COVID infections early, so just double check that. And then after you get an infection, your PCR test might be positive for up to weeks or up to 3 months. So just something to think about as well. Lastly, uh, even though cases are rising, something that's kind of changed the game over the last few months is that we have treatments. So we have preventative treatments such as Evusheld, which is a monoclonal antibody that someone can take that will cover them for 90 days, kind of like a preventative measure. So if you have someone who is like a cancer patient or a high-risk pediatric patient who meets the criteria, they might be able to get that like injectable. So for the next 90 days. So let's say this fall when we expect a surge, like maybe at the end of summer, this patient might want to get Evusheld, kind of like the name implies, it's like an extra shield of protection for the patient. And then lastly, two medications. The main one, Paxlovid, is available at a lot of pharmacies in Stockton, and you can find out more information about that in the sanjoaquincounty.gov website on where to find Paxlovid, which is an oral medication, kind of like Tamiflu, but it works a little bit better. The only thing I will say with Paxlovid is you have to take it early, so within 5 days of your positive test, and also you might want to double check with your local pharmacist or your doctor if there's any drug-drug interactions. So that's kind of all I wanted to start out with. I hope that was kind of helpful. Did that make any questions so far, anything like that?
I think that was a really good overview, especially when we last met back in January. And it seems like we did do these like sort of quarterly check-ins, and it seems like things are improving, but we're not just there yet. And so like with treatments available and now like the boosters are expanding, no, this is sort of a great start. So thanks, thanks,
Yeah,
Freddie.
for sure, for sure.
Yeah, and I'll kind of leave it open to anyone, like I said, this is a Q&A session. So if anyone has any questions for Freddie, like feel free to drop it in the chat. And of course, like we'll kind of continue the conversation here and we'll definitely pause to open up for questions. And so as we kind of wait for questions here, Freddie, something that's been in my mind because like, I live in a Filipino like household. So there's a lot of people like living in one roof. So if someone has COVID and has been infected with COVID, what's the best way to protect like multi-generational households?
Right. So this is a question that I don't think a lot of news outlets or everyone kind of hits the same way. But yeah, like you mentioned, in Filipino households, you have, your grandma, your lola, your tito, tita, all that stuff, right? So
Yeah.
the best thing you want to do is kind of like you're going to want to treat your household like a miniature kind of like hospital, if you will. So let's say a person in the family gets positive for COVID or has symptoms, right? So the first thing you want to do is test the person. If they're positive, you want to confirm their symptoms. First of all, if they're positive. So that's the first step. If someone's positive, you want to see it, if possible, like isolate them in a separate room in the house. Now, if that's not possible, you might want to ask your relatives for help. Hey, like, do you happen to have a spare room or something where this person can stay for, up to 5 days? So that's one thing you can do. If if there's no possibility for people to kind of quarantine like outside of the house, one thing you can do is make sure there's adequate airflow whenever you and the infected family member are in the same area. Another thing you want to do is when the infected person and another family member are in the same area, is both of you wear good fitted masks. So KN95s and 95s are the best protection against that. And you also want to care for your family member too. So along those things, you want to make sure that that person is, timing out their symptoms. So day zero again is when they're test positive or have symptoms. You want to make sure day zero through day five, that person is improving in their symptoms. If they're not, you might want to seek further help. You also want to help that person if they need help, with some like regular medications. You might want to get some over-the-counter symptom management medications, so Mucinex, Tylenol, all those sorts of things. You can help your family member get all that stuff. I would just say that be careful when you contact, face to face with the family member. And I would also recommend that if the family member who's infected touches certain things in the house, that those things get cleaned right away. Even though, COVID's more of a respiratory infection, you don't want to inadvertently touch something that they accidentally touched and then touch your like T-zone area and infect yourself. So those are some things I would think about. I know it's going to be awkward to wear a mask in your own house, but if you have a large family household where you don't want to get everyone sick and you have high risk individuals, you want to protect everyone as best as possible. So quarantine, if that's not possible, the best fitted masks you have on to help that family member, and try to stick it out for 5 days and treat the symptoms as best as possible. Yeah.
Awesome. Thank you. I know you talked a little bit about sort of the medications of how to treat COVID. So, like, what do you think? What are the best ways to treat COVID symptoms at home? I know you mentioned a couple of medication. Are there any other practices that can really help?
Yeah, so COVID, I wouldn't, it's similar to a cold, but it's not. It has a similar symptoms, right? We talked about this last time where all the symptoms kind of overlap. You have your cough, fever, a runny nose, and all that stuff. And so if you're fully vaccinated, you got a booster, you're not too, you're not feeling bad, you're kind of monitoring your symptoms, and they're not too crazy and you can breathe okay. I would recommend, some over-the-counter stuff helps really well. Your typical things, Dayquil, Mucinex, where they contain medications such as Tylenol, guaifenesin, which helps break up mucus, and dextromethorphan, which helps with coughing. So there's a lot of those combo medications out there that, as long as you don't overlap, so if it contains Tylenol, you don't give someone too much Tylenol. I would say that any of those are perfectly fine to help with the symptoms. Um, if those don't work and you feel that that person is getting worse, again, we still have treatments available. So the patient can go to urgent care or to the hospital and get monoclonal antibodies. That's still on the table, even though we have different variants. Paxlovid again is a quick solution that most people can get at their local pharmacy. So all of those together are what I would recommend. But mainly, any over-the-counter medication to help with the symptoms is what you'll find. I think again, just monitoring the symptoms is really the main thing for that. So hope that kind of like answers the question. Yeah.
Yeah, no, it definitely answers the question. And I'm looking at the chat too, and I saw Anahit posted a question.
Uh-huh.
Where are available testing spots in Stockton? So like we talk about treating COVID symptoms and then now sort of the preventative measure of testing. I don't know if you wanted to speak on that a little bit, and I could also help elaborate, some of the resources the county has also.
Yes, I'll just touch on. So we talked about a little bit about treatment, right? But kind of like taking a step back about testing, right? So
Yeah.
definitely, as we move into the summer and into the winter and this fall, like it's a good idea, I think, that everyone carry a couple tests around per person. So home antigen tests have gotten better over the last year, and I think that it can help save you infecting someone else, or you kind of like prolonging your infection. So I would say like the first second you have symptoms that are evident of possible COVID, and you figure out like, oh, I've got exposed, I would take a test. That kind of starts your day zero. Again, taking a home antigen test within 3 to 5 days of exposure is like the best timing. Antigen test, if you're positive, then you're positive. That's kind of like how I tell people. If you're positive, then you have it. Um, if you test too early with antigen tests, it might come back as a false negative, although the antigen tests are a lot more sensitive nowadays. And by the time you have symptoms, then you're probably like, well, way past the first few days. So that's the thing I'd recommend. So some questions I've got, at least like actually this week about it. If you take an antigen test, is it necessary to take a PCR test to confirm it? I would say, if you don't have to go outside of your house, I think it's okay. The only reason why I would be okay with doing a PCR test after a positive antigen test is if you're asymptomatic or if your workplace requires that. So like if you need to confirm through a PCR test from your workplace, then that's the only other reason. Otherwise, you just stick it out for the 5 days. And then after the thing that I guess is nuanced for this is when you get an infection after the first 5 days, if you want to test to see if you're still infectious to others, after the first 5 days, then you can take an antigen test. So like day 6, you're like, oh, I'm feeling a lot like way, way better than day 1. Well, I just want to see if I'm still infectious so I can go around others and do this sort of thing. So I would take antigen test there. And then the rule of thumb is that I tell people, your antigen test only kind of counts for the next 12 to 24 hours after you take the antigen test. So
Mhm.
let's say today you test negative, you have symptoms of coughing and stuff, and today you test negative with the antigen test. I would recommend getting another test in the next 24 to 48 hours just to confirm that it's not COVID. Because again, like just because you're negative today, doesn't mean that your COVID symptoms aren't gonna show up even worse in the next 48 hours. So, that's what I would recommend.
Thank you, Freddie. And I
Hmm.
don't mean to throw a curveball, but you mentioned that antigen tests are becoming a little bit more like reliable from previous. Are there
Yeah.
certain brands that you know of that are like when you say more reliable compared to like other brands?
Yeah, I think one of the most common and most reliable ones are the FlowFlex tests actually.
Okay.
FlowFlex and Binax Now I think are the best ones. I know that Binax Now came out a while ago and there was a shortage and stuff like that. Those are the two tests I would recommend the most. One because their expiration date is like almost 6 to 8 months after purchasing it, so that's great. Some tests that I've had, their expiration date is, after a couple months of purchasing. So they're not really reliable, like if you're going to stock up, for instance. So that's a good point actually that I just brought up. Check your expiration dates. If it's getting pretty close, the expiration date, you might want to be careful. Like, not saying that you can't use that test, but use your best judgment. If it's at past expiration date, obviously don't use that test. I would just get a new one. But yeah, Flowflex and Binax Now are my two favorite ones. And I know the government, they sent the one with the orange box. I forgot the name of that one, but that one's a good one too. I
Is
know
the
that's pretty
iHealth
real.
ones by
The iHealth
chance?
one, there you go.
Okay.
Yeah, so iHealth, Binax Now, and Flowflex, I think, are the top three. There's new tests coming out every time. I wouldn't be surprised if for this next round of COVID tests that are free, there's a new
Mhm.
company. So but I think that's pretty reliable. Just figure out what the expiration date is and go from there.
All right, that sounds good. And shout out, like Lila Manila has iHealth and Binax tests, and we don't do
Hey,
it yet. So I just wanted to be sure that that we have them on supply, and just to share everyone that is joining with us today that you'll also have a chance to get free tests, and we'll kind of share how that process works towards the end when we share resources. So yeah, I'm looking at the chat. We had Anahit, so thank you very much, Anahit, for joining us. And I know we're approaching time. We're about 10 minutes left here. So for all those that are joining us, like please feel free to ask your question um, for Freddie regarding COVID. But we'll continue the conversation here. Yeah, I had to be very specific
yeah,
about that. Um, let's see. And some other things I'm also thinking about is, we're kind of reaching this like this endemic. We hear this discussion about endemic. From your
right.
perspective as a health professional, like what is endemic and this discussion of like more like vaccines in the future, and how that kind of plays a part into the endemic.
Right. So yeah, endemic seems to be everyone's like Willy Wonka golden ticket sort of thing, right? But so it's gonna be hard to really like establish this as like an endemic thing because COVID is a respiratory virus. It's spread pretty quickly. It's contagious. People can get reinfected and stuff like that. The definition that I personally look for, and I think a lot of people are kind of thinking about in the healthcare field on the front lines, is seeing cases go steady. So right now we're having like surge after surge, right after surge,
Yeah.
and one that weighs in on a lot of healthcare providers. So we don't want to like open up the floodgates, if you will, even though we kind of already have. As far as as far as like, making things like, oh yeah, yeah, everything's cool now. I think we're getting close. Some things that I'm watching out for again is cases. Right now, cases are rising. I expect a micro surge, if you will, this
Mhm.
summer. Maybe a little bit less than what we had in Delta, which was pretty crazy last summer. I do think this fall and winter we should expect a rise in cases just because COVID is a respiratory virus. So respiratory viruses usually thrive in cold weather. So I think
Mhm.
after that, hopefully, what I'm hoping for is we have a lot of different types of vaccines out there that will help with immune protection. We're almost at like 70 to 80% immunity, and what by that I mean we have people who are fully vaccinated. We have people who got COVID
Mhm.
and survived and now get immunity from that. And we have people who got COVID and also got fully vaccinated, so they have like super immunity. So we're getting really close to endemicity. I would say maybe after this fall and winter, we'll kind of like reassess.
Yeah.
Um, and that combined with the virus mutating itself into something that's like a common cold, so we have Omicron variant, what are BA 4 or 5
Yeah.
nowadays. So as it continues to mutate, it might get slightly more contagious. You might hear that on the news, but
Mhm.
that might also take away from its ability to hurt people as much, right? So you've
Yeah.
seen more people more recently with Omicron, maybe 3 or 4 or whatever, having no fever, but just having cough and like an itchy throat for a few days. So I've seen that in a couple people. And hopefully the virus will mutate itself out after this last surge in the fall and winter, and with that, and combined with vaccines and immunity, and then treatments that are super easily accessible, like Paxlovid, I think we're going to find ourselves in good shape, end of the year, end of summer, and then beginning of next year. That's what I think is going to happen
Mhm.
because even though we've had these huge surges over the last couple of years, I think we're slowly
Yeah.
getting to a place where Omicron can't really hide or like
Yeah.
can like and like reinfect new people, you know what I mean? Like it's infected so many people that there's protection for everyone, so it doesn't last that
Mhm.
long. The only thing that I could think of that might kind of flip the whole table upside down is if Omicron mutates again in like animals, and then like our conversation before where mutations happen between animals and humans and stuff like that. So
Yeah.
but that's a conversation maybe that doesn't need to be had until it happens. For right
Yeah.
now, I think the focus should be, protecting yourself. If you see a surge,
Mhm.
change your behavior a little bit. Maybe you don't want to be, you maybe you want to social distance or mask here in a crowded area or at the gym during certain times of the day. I think it's totally okay to make your own decisions in that way. Just keep in mind, like be prepared, like any sort of emergency. Like, get your mask and test ready in case something happens, and I think you'll be all set for the summer and winter and fall. And that's kind of like how I kind of like think about it. But we're close. We're getting close. And I think everyone
Yeah.
says that every like month we're getting close to the endemicity, and like I'm just watching the cases. The second we flatline, all right,
Yeah.
I think we'll be good. I think we'll be good. But just keep an eye on that. Cases are going to rise and fall. It's expected with respiratory viruses, but
Yeah.
I think we're in good shape for now. Yeah.
Good. And I think that's what we're all waiting for is that sort of, flat line. And for all our
Yeah,
healthcare workers who
exactly.
are working, and also for us who are looking for, I know we always say like the sense of normalcy, but to just be safer together.
Yeah.
So yeah, I'm excited for when that happens, but I know we're in better shape. Um, and I think the last question at least that I have is because I know we've been talking a little bit about like the Omicron sort of variants, BA.4 and 5 especially. So like, currently, like, how do you know when a surge is happening, or what are some sort of signs that we should look
Yeah.
at? Yeah.
Yeah, so for me, or what I've seen, obviously this is going to be whatever the next surge will be Surge 6.0 for us right now, which is
Yeah.
interesting to think about. But some things that will characterize a surge to me is cases are going to continue to rise, and
Hmm.
following that will be unfortunately deaths, like at least 2 or 3 weeks after that. The beauty of right now, even though cases are rising, we aren't seeing deaths kind of follow that. And again, that kind of like goes along with vaccines and treatment stuff like that. So like a legit surge, I would see cases, and then 14 days later, we'll see a few more deaths than usual. Currently in San Joaquin County, over the last 7 days, they reported 2 deaths from COVID specifically, and about 500 cases over the last week. increase. So that's kind of a good baseline. I would encourage you if you're really like worried, keep an eye on the news, keep an eye on the CDC case rates. If it's just
Mhm.
going up like a mountain and stuff like that, you might want to change your behavior a little bit. I don't expect we're going to have any more masks mandates or any vax mandates or things like that. But I think because of we're not going to have any mandates, it's really up to you to like be diligent and protect yourself. Um, I would say that another thing to look out for is if you have healthcare workers in the hospitals, just ask them, is your hospital overrun with COVID? Nowadays, even though cases are rising, we have all the tools in our tool belt to treat patients and sequester them
Mhm.
in a way that treats everyone, as best as possible. So that's something I would look into. And I'm always a resource if you guys ever think that a surge is coming, I can always help out in that way. But again, the main things is kind of looking at social behavior. Are more people wearing masks? Are cases rising in San Joaquin County? And you could find that out with San Joaquin County website or CDC. But yeah, those are the two main things that characterize a surge for me. Are the hospitals filling up? That's another thing. So
Okay.
yeah.
Well, thank you, Freddie. I really
Yeah.
appreciate that and all the insights. And I know we're kind of approaching time, so I'll ask one more question. And I'll give it to anyone else too, like if anyone has any lingering questions. But I know this isn't going to be the last time that we're going to see you, of course.
Oh yeah,
So I
yeah.
guess, well, we love to have you. And so, any other, like, I know you mentioned a couple of things with the key takeaways, but is there anything high level that you want the audience here to kind of come away with from this discussion?
Yeah. I think the biggest thing that I want to take or want people who are like the few people here, like thank you for supporting that are watching this, like, and I think this is the attitude we should take away from here on out. You know, I think we should all have the confidence that our vaccines, therapies, protections, and stuff like that are actually really good. I think sometimes either social media or the media or like people who are misinformed might spread fear that makes you second guess certain things and then start panicking and then you start stressing out about certain things about COVID stuff. COVID is still we're still in a pandemic. COVID cases are rising, falling, things are changing day to day, but that shouldn't take away from the protection of the vaccine. So even though our current vaccines for Pfizer, Moderna, and J&J, if you can't get the Pfizer, Moderna, are based off of the old variant of COVID, they still have really good protection for people who are without health risks and those with high risk. We have treatments available that are pretty good. I know you might hear with Paxlovid like recurrent COVID infection. That might be something you want to talk about with your doctor. And again, you're monitoring symptoms. So if symptoms happen, then you quarantine and all that stuff that we talked about before. We have monoclonal antibodies. We have all kinds of stuff in our tool belt to help us protect each and every one of our family members, everybody around us from COVID, and so we can get through, any sort of surge. So I think the biggest takeaway is like don't be afraid like we're helpless with COVID. We have so many resources with COVID. I think, your team does a great job with doing the vaccines and testing and putting out resources, Traumacist RX, my YouTube channel, I try to put out some resources that you might want to follow and stuff like that. There's a lot of data coming out, and I think, trying to not get mixed in, all the negativity with COVID cases rising, stuff like that is kind of what we should focus on. And the CDC and FDA, I know maybe it's got been scrutinized a lot recently, but we have all kinds of stuff in our tool belt now. We aren't back in, March 2020 where we didn't know anything. We have the right treatments. We've studied all the treatments that don't work, like ivermectin. We've done all kinds of things from now. Like I feel pretty confident myself. Like so, I'm triple vax. Sometimes I wear a mask in crowded areas. I still go out to eat things like that, only because I feel confident that our science has taken us this far. So for me, again, like don't be too afraid. Like wear your mask if it makes you feel comfortable. That's totally fine. Don't let anybody judge you on that. But I think we're heading in the right direction. Just be careful
Yeah.
this summer and wait till the surge kind of like subsides, and then this fall and winter again, like take the best precautions as possible. So
Yeah,
I know
no,
that was
thank
like a long way of saying like stay positive, everything's cool, but really like nobody really talks about that in
yeah.
the media really. Like so we have like be confident. like we have so many good treatments and stuff out there, and as long as you and your everyone around you is fully vaccinated, like I think you don't have much to worry
Thank you, Doc. I know you hear it here first from Dr. Freddie Ray. Like we've been in isolation for a lot, large part of 2 years, and so now we're
Yeah,
kind of now we're getting back into it. So having fun, but also being responsible, taking care of
exactly,
others.
exactly.
Still thinking about your community. And so I definitely want to give you time and to shout out Traumacist RX. I'll give you a little bit of a plug there. Yeah, because I
Yeah.
know that's a channel that people can keep up with you, and also ask questions if when anything arises. But yeah, do you mind explaining a little bit of Traumacist RX and
Yeah,
what you're
so
looking for with
Trauma
them?
Assist
Yeah.
RX is my YouTube channel that I started last year in back in June. The focus is to create videos that help you understand healthcare a little bit easier. So I have a video on treating your allergies coming out hopefully over the weekend. I've been kind of busy with COVID and stuff like that, but my Instagram, my TikTok, I have a lot of different videos. So if you're healthcare or someone, if you're like looking to get into healthcare, like I talk about, drawing up medications, being a pharmacist, motivational tips so that way you don't burn out. And I do have a lot of ideas and recordings ready to be posted. So like and subscribe if you're interested in that stuff. It's kind of like having a little session with me on like learning healthcare that you might be confused about. So I know that a lot of the patients I see, their family members are super confused about what's happening to their family member. So my goal is to try to explain all of that in an easy and fun way on YouTube. So check it out. Follow my Instagram, YouTube, TikTok, and definitely more content coming out through the rest of summer.
Yeah, I really recommend following the channel. I've learned a lot of things, and it does give you that confidence. I mean, sort of in the spirit of education. I also wanted to share a little like a workshop that we're launching in early June. So the Echo team will be launching a COVID Community Ambassadors virtual workshop, hoping to get it in person. But the goal of this workshop is for folks to learn really more about COVID in depth. Also learn about health through a social justice lens, similar to what we do here at Little Manila Rising. And then learn healthcare admin skills that can really help when volunteering at health and vaccine clinics. And I'm happy to announce that participating is free and registration will open really soon, so please stay tuned. Um, and so I think the last thing that I also want to mention is that if you like these educational events and also want to learn about Little Manila programming, such as asthma mitigation program, environmental justice initiatives, please share our profile, Little Manila Stockton, and please follow Freddie at Traumacist RX. Together we're creating healthier communities, and we couldn't do it without all of you. We're equipping you with information so you can hopefully share with your circles and create that confidence with everyone in the community. Before we officially log off, I just want to sincerely say thank you, everyone that joined us. And also thank you very much, Dr. Ray Freddy, for being a friend of Little Manila and just continuing this with us. And I'm really looking forward to our next check-in pretty much.
Yeah, definitely. Thank you for the opportunity. Thanks to those who jumped on to the live. Hopefully, we'll see more of these lives, education, stuff like that. I think that Little Manila does a great job. So stay tuned. I know that they have a lot of other diseases they're going to cover and other like social justice and other things like that coming up. So thanks for the opportunity again, and thanks for everyone who tuned in. Hopefully you like this, and hopefully we can do more. Yeah, this is awesome.
Oh, heck yeah, we're definitely going to do more. I'm seeing a nice public feedback that we should probably return very soon and give some
Yeah, for
updates.
sure.
And yeah, well, thank you very much, Freddie. Thank you very much, everyone. I hope you have a great evening. Have a good, almost said Friday. Have a great Thursday evening. That's what it feels like.
All right,
Take care, everyone.
everyone. Take care.